Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
Your patient says they're short of breath. They look comfortable. They're talking normally, but the pulse oximeter shows 89%. Should I be worried? Today, we're talking about SpO₂ monitors, also known as pulse oximeters. A pulse oximeter is a small electronic device that clips onto the finger and estimates the percentage of oxygen being carried by the hemoglobin in the blood. This measurement is called oxygen saturation, or SpO₂. The monitor works by passing light through the finger and measuring how much oxygenated and deoxygenated blood is present. Most devices also display the patient's pulse rate. In first aid and pre-hospital care, SpO₂ monitors can provide valuable information about a patient's breathing and circulation. They may be used when assessing patients with short of breath, chest pain, asthma, COPD, pneumonia, allergic reactions, or altered conscious states. For many healthy adults, a normal oxygen saturation reading is typically between 95 and 100%. However, numbers should never be viewed in isolation. Some patients with chronic respiratory conditions, such as COPD, may normally live with oxygen saturations much lower than this. A reading of 90 or 92 may be normal for some of them, while the same reading in another patient could indicate significant illness. This is why patient history is so important. Ask the patient, do you know what your normal oxygen levels are? Is this different from your usual reading? Pulse oximeters also have limitations. Things like cold fingers, poor circulation, nail polish, patient movement, and poor probe placement can affect accuracy. So if the number doesn't look right, change fingers or change hands. Most importantly, treat the patient, not the monitor. A patient who is blue, struggling to breathe and deteriorating requires urgent attention regardless of the number on the screen. And a patient who is comfortable with a known medical condition may have a lower oxygen saturation than normal for them. The SpO₂ monitor is just another tool that helps build a clinical picture, because sometimes the number tells part of the story, but the patient always tells the rest.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.
Welcome to your daily